Are you looking for answers to your questions about coprophagia in dogs? Do you want to know if it is normal for dogs to eat poop, or if it is a sign of an underlying issue? If so, you have come to the right place. In this video, we will explore the topic of coprophagia in dogs in detail. We will define what coprophagia is, discuss its prevalence in dogs, and go over the different types of coprophagia. We will also touch upon the possible reasons behind this behavior and its potential health risks. At the end of the video, we hope you will have a better understanding of coprophagia in dogs and feel more confident in addressing any concerns you may have. If you find this video helpful, please consider subscribing to our channel for more informative content about pets and animals. Let's get started. Firstly, let's talk about coprophagia. Coprophagia is the term used to describe the behavior of dogs eating feces, whether it is their own or that of other animals. It is not uncommon for dogs to engage in this behavior, but it is important to understand why they do it. Coprophagia is a common behavior in dogs, but it is still not entirely clear why they do it. There are different theories as to why dogs engage in coprophagia, including 1. Nutritional deficiencies. Some experts believe that dogs may eat poop to supplement their diet with essential nutrients that they are lacking. However, this theory has not been proven. 2. Behavioral issues. Coprophagia can also be a sign of underlying behavioral issues, such as anxiety, stress, or boredom. Dogs may also eat poop as a way to seek attention or to get a reaction from their owners. 3. Instinctual behavior. Another theory is that coprophagia is an instinctual behavior that stems from the time when dogs were wild and had to scavenge for food. Regardless of the reason, coprophagia can be a cause for concern for dog owners. It can lead to health problems and can also be a sign of underlying medical conditions, such as parasites or digestive issues. Now let's talk about prevalence of coprophagia in dogs. Studies have shown that up to 16% of dogs engage in coprophagia. Puppies are the most likely to engage in this behavior, as they are still exploring their environment and may not have learned appropriate behaviors yet. Adult dogs can also engage in coprophagia, especially if they are not getting enough attention or exercise, or if they are not being fed a balanced diet. There are also certain breeds that are more prone to coprophagia than others, such as Labrador retrievers, beagles, and pugs. This could be due to their genetics or their history as working dogs. Now let's talk about different types of coprophagia. There are different types of coprophagia in dogs, including 1. Autocoprophagia. This is when a dog eats its own feces. This is the most common type of coprophagia and can be caused by a variety of reasons, such as boredom, anxiety, or medical issues. 2. Allocoprophagia. This is when a dog eats the feces of another animal. Dogs may do this out of curiosity, or they may be attracted to the smell or taste of the feces. 3. Pseudocoprophagia. This is when a dog only shows an interest in feces but does not consume it. Dogs may sniff or lick feces without actually eating it. It is important to identify the type of coprophagia your dog is engaging in, as it can help determine the underlying cause and the best course of action to address the behavior. Now let's talk about behavioral reasons for coprophagia. 1. Common causes of coprophagia. One of the most common causes of coprophagia is simply a lack of nutrients in an animal's diet. If an animal is not getting enough nutrients from their food, they may turn to eating feces as a way to supplement their diet. Another common cause of coprophagia is simply boredom. Animals that are left alone for long periods of time with nothing to do may turn to eating feces out of sheer boredom. 2. Medical issues that may lead to coprophagia. There are several medical issues that may lead to coprophagia. For example, animals with malabsorption syndromes or other digestive issues may be more likely to engage in coprophagia. Additionally, animals with pancreatic insufficiency may be more likely to eat feces. It's important to note that if your pet suddenly starts engaging in coprophagia, it's important to take them to the vet to rule out any underlying medical issues. 3. Psychological reasons for coprophagia. Psychological factors can also contribute to coprophagia. For example, animals that are stressed or anxious may engage in coprophagia as a way to self-soothe. Similarly, animals that have been punished for eliminating in inappropriate places may start eating their feces as a way to avoid punishment. 4. training and behavioral interventions to prevent coprophagia. The best way to prevent coprophagia is through proper training and behavior modification. One way to do this is through positive reinforcement training, where you reward your pet for good behavior and ignore or redirect them when they engage in undesirable behaviors like coprophagia. Another way to prevent coprophagia is to make sure your pet has plenty of mental and physical stimulation to prevent boredom. Additionally, it's important to make sure your pet has a healthy, well-balanced diet to prevent nutritional deficiencies that may lead to coprophagia. Finally, let's talk about how to deal with coprophagia. One of the most effective ways to prevent your dog from eating poop is to clean up after them immediately. This means scooping their poop as soon as they go, and keeping your yard and walking areas free from other animals' feces. You can also try to distract your dog when they show interest in poop by redirecting their attention with a toy or treat. Providing your dog with plenty of exercise and mental stimulation can also help prevent boredom, which can be a trigger for coprophagia. Next, let's discuss some things to avoid doing if your dog eats poop. One common mistake is to punish your dog for this behavior. However, this can actually make the behavior worse, as your dog may feel anxious or stressed and resort to eating more poop. You should also avoid feeding your dog a low-quality diet, as this can lead to nutrient deficiencies and increase the likelihood of coprophagia. If your dog has already developed coprophagia, there are some medical treatments that may help. Your veterinarian may recommend adding certain supplements or enzymes to your dog's diet to improve their digestion and reduce the appeal of feces. There are also medications that can be prescribed to reduce your dog's interest in poop. Finally, it's important to know when to consult a veterinarian. If your dog is eating poop frequently and it is affecting their health or behavior, it's important to schedule a veterinary appointment. Coprophagia can be a sign of underlying health issues, such as malabsorption or parasites, and your veterinarian can help diagnose and treat these issues. In conclusion, coprophagia can be a frustrating and difficult behavior to deal with, but there are ways to prevent and treat it. Remember to clean up after your dog immediately, provide plenty of exercise and mental stimulation, and avoid punishing your dog for this behavior. If your dog does develop coprophagia, there are medical treatments available, and it's important to consult with your veterinarian if you're concerned about your dog's health or behavior. Thanks for watching, and we hope this video has been helpful for you and your furry friend.